Good day everyone. Hi, it's me again, Nurse May. And in continuation of our hygiene return demonstration, today I'll be performing the bed bath. Before entering the room, we are going to knock the door and then we are going to introduce ourselves. Hi ma'am, I am Nurse May. Then we are going to verify the patient. Okay, so you are Mrs. Luares. Then we are going to explain the procedure, why we are doing the bed bath. Ma'am, I'll be doing your bed bath today. Then after, we are going to prepare our equipments. So I have here some bath towels, a bath blanket, washcloths, disposable gloves, deodorant and lotion, soap, comb, basin with water, and soap dish, and of course water, clean warm water. Next, we are going to perform a hand hygiene. It's either to wash our hands or to sanitize them. Then we will provide privacy to the patient. We are going to close the door or close the curtain. Now we are going to prepare the client and the environment. We are going to ensure a comfortable temperature for the room, and we are going to position the client in an appropriate position. So we are going to move down the rails and we are going to move the bed in an appropriate position. Then the next step that we are going to do is to get our bath blanket. And we are going to place it on the top of the patient. And slowly we are going to remove the top sheet without exposing the patient. Then immediately we are going to put the soiled top sheet into the linen bag without touching our uniform. Then sanitize again. Next, we are going to remove the patient's gown without exposing any part of the body of the patient, starting from the shoulder of the patient. Then again, we are going to put this to the linen bag without touching our uniform. The next step that we are going to do is to fill the basin with water and check its temperature. So before I already put some water in the basin and I already checked the temperature. Next, we are going to wash the face of the patient, but before that we are going to ask her if she want soap in her face. Okay, ma'am, do you want me to put some soap in your face?
No.
First, we are going to put a towel on the patient's head. This is to protect the pillow from getting wet.
Then, using a washcloth, we are going to make a bath mitten.
Now we are going to start to wash the patient's face, starting with her eyes. And after washing the patient's face, we will immediately dry them. Then we are going to dry the patient's face. After washing the patient's face, now we are going to wash the patient's arms and hands. So first we are going to wash this, the right hand and arms of the patient, which is away from us. Then we are going to place a towel lengthwise on the right arm, below the right arm of the patient. Making sure that we are not exposing unnecessary part of the patient's body. Using another washcloth, we are going to make another bath mitten. Then we are going to put some soap and start washing the patient's arm and hands, starting from her wrist. By the way, we are going to use firm and long strokes. Then we are going to dry the patient's arm and hands. Then we are going to repeat it on this side, on the left side of the patient's arm. After washing the patient's both right and left arms and hands, now we are going to wash her chest and abdomen. First, we are going to get a bath towel and place it lengthwise to the patient's chest and abdomen. Then we are going to fold the bath blanket downward to the patient's pubis. And again, we are going to make a bath method using the washcloth. And without exposing the patient's body or any part of the patient's body, we are going to start washing the patient's chest. But first, we must put some soap. Another bath mitten using the washcloth for the patient's abdomen. Then we are going to dry them. Then we are going to wash the patient's back. First, we are going to assist the patient into a side lying position. Ma'am. Next, we are going to place a bath towel on the patient's back along with the patient's back down to her buttocks. Making sure that the bath blanket is in a lengthwise position. Now we are going to make a new bath mitten using a washcloth. In washing the patient's back, make sure that we are going to start from the patient's shoulder down to her buttocks. And then we are going to dry it. After washing the patient's back, now we are going to help her back to her position since we are now going to start washing her legs and feet. In washing the patient's legs and feet, we are going to start from exposing the leg farthest from us. And making sure that the perineum area is covered. Then we are going to put bath towel and start to make a bath mitten using a washcloth. Then we are going to put some soap. Then we are going to start to wash the patient's legs. After, we are going to rinse it using a new pair of a new mitten wash cloth. And then we are going to dry it. Then we are going to repeat the procedure to the leg that is near to us. After washing the patient's legs, now we are going to wash the patient's perineal area. But since our patient is independent to do it, we'll ask her if she wants us to do it. Ma'am, you want me to clean your perineal area? Lastly, we are going to put a new patient's gown to Mrs. Luares and asked her if she wants us to put her some deodorant and lotion or powder.
And lastly, we are going to assist with care for hair, mouth, and nails.